Texas Children's Hospital is a nationally ranked freestanding 973-bed acute care women's and children's hospital located in Houston, Texas. It is affiliated with the Baylor College of Medicine and is located within the Texas Medical Center. The hospital provides comprehensive pediatric specialties and subspecialties to infants, children, teens, and young adults aged 0 to 21 throughout Texas and features an ACS-verified Level 1 pediatric trauma center. Its regional pediatric intensive care unit and neonatal intensive care units serve the southern United States region and also has programs to serve children from around the world. With 973 beds, it is the largest children's hospital in the United States. The hospital is ranked as one of the best children's hospitals in the country and the world. The 2020-2021 edition of U.S. News & World Report ranked Texas Children's Hospital number 4 amongst 200 pediatric hospitals in the nation, and has been recognized on the U.S. News & World Report Honor Roll for 12 consecutive years. In 1940, Texas Medical Center was first chartered as a set district. Texas Children's Foundation is formed to gain support to build a children's hospital, and 6 acres was set aside for the planned hospital. Groundbreaking for the new building was held in May 1951. As the hospital was being built, hospital leaders established a relationship with the Baylor College of Medicine to allow students to be taught at the new hospital. The original TCH was planned to have 3 floors and 106 beds. Texas Children's Hospital was first opened on February 1, 1954, creating the first children's hospital in Texas. From the start in 1954, Physician-in-Chief Russell Blattner established a new policy that at least one parent may be with a child during a hospital stay, setting a standard for parental visitation now commonly seen at children's hospitals around the world. In 1962, Texas Children's Hospital partnered with St. Luke's Episcopal Hospital to open up the Texas Heart Institute. Years later, Texas Children's Hospital separated from the Texas Heart Institute, instead establishing their own pediatric cardiology program. Over the years, patient numbers at TCH continuously increased. The hospital was forced to complete a $149 million expansion in 1989 that constructed 2 new buildings, the West Tower and the Wallace Tower. In addition to the new buildings, TCH also renovated the main building known as the Abercrombie Building. On September 21, 1971, the patient known as Bubble Boy, David Wetter, was born at the Texas Children's Hospital. Wetter was immediately placed into a sterile bubble because of his SCID diagnosis. The boy lived in the hospital throughout his life before being discharged a few years later. Eventually he went to the Dana-Farber Cancer Institute for an experimental stem cell transplant, but died days later after contracting Epstein-Barr from the marrow, which had been undetectable in the pre-transplant screening. By 1993, the hospital officially had 465 licensed beds. When Hurricane Katrina first hit New Orleans in August 2005, Texas Children's sent helicopters to Tulane Medical Center, Oxnard, and CHNOLA in order to help evacuate pediatric patients from the hospital. In addition to helicopters, Texas Children's sent multiple fixed-wing aircraft, ambulances, doctors, and nurses to Baton Rouge to help with patient care in New Orleans. In the aftermath of the storm, TCH and Baylor College of Medicine also took in pediatric residents from Tulane to continue their education. Texas Children's Hospital was the primary pediatric evacuation hospital during Hurricane Katrina. In November 2020, Dwayne "The Rock" Johnson collaborated with Microsoft and billionaire Bill Gates to donate Xbox Series 10 consoles to the Texas Children's Hospital along with 19 other children's hospitals throughout the country. Also at TMC, the Baylor College of Medicine and Texas Children's also operate the nation's only children's nutrition research center, a United States Department of Agriculture facility that researches the nutritional needs of pregnant women, nursing women, children, teens, and young adults. The hospital operates several research centers, including the David Center, which was established in 1984 to honor David Wetter, the 12-year-old also known as the Bubble Boy, who died of a rare immune system disorder. The David Center is dedicated solely to treating immunological deficiency diseases, especially those involving the development of cancer. In addition to their pediatric specialties, Texas Children's Hospital serves adults through a couple of their nationally recognized programs. TCH has one of the largest adult congenital heart disease programs in the U.S. and recently opened up a 16-bed inpatient unit to care for ACHD patients. Additionally, TCH houses the 106-bed Texas Children's Hospital Pavilion for Women, providing gynecological and maternity care for women of all ages. In the wake of the